I'm Nick Black. I'm Professor of Health Services Research at the London School of Hygiene and Tropical Medicine, working on quality in care. I think the most important thing to understand when we're dealing with quality of care is to recognise the different dimensions of it. People very often mix them up, and we want high quality care to be safe, in other words, to do the patient no harm. We want it to be effective, in other words, that it's doing some good. We also want it to be humane, in the sense that people are treated in the way that you would like to be treated, with dignity and respect and given the information you want. And we also want it to be equitable, that people would receive the same quality care regardless of their age, their sex and their ethnicity and so on. Now that sounds terribly simple, that we just take those 4 dimensions. The problem is we can't maximise them all, and there's got to be some hard choices and trade-offs. So for example, you might have to decide that you'll put up with a certain amount of inequity simply because that will make the services you're providing more efficient. And that's an uncomfortable choice people have to make, but often people think that they can have the maximum of all dimensions of quality. I think it's important when we're approaching quality to recognise that there are 3 activities that we want to undertake. We need to define what is good quality care, and that should, as far as possible, be based on scientific evidence. Often the evidence isn't there, but that should still be our goal. How should a patient be treated with a particular condition in this particular country? Having done that, then what we need to do is assess the quality of services that are actually being provided, and almost inevitably in every country of the world we're going to find that there is scope to improve the quality. And then finally, the hardest part of all is, having found quality isn't as good as it could be, how can we improve it? So we need, and I think it really helps to separate out defining what's good quality, assessing quality and improving quality. There's a whole number of ways of trying to improve quality, be it education, regulation, incentives and so on. But there are some common lessons that we can learn from all these different approaches. The first is that quality will only improve if the people whose behaviour needs to change, the doctors, the nurses, actually want to participate. You cannot force people to provide better quality care. So they have to recognise that the quality they're currently providing is not ideal. And of course that can be quite uncomfortable for them if they've always felt that they were doing a really good job. So it's not about punishing them, it's about showing them that the ways in which they could do it better. Secondly, it's really important that the respected opinion leaders are on board. Without that, it's again unlikely that improvement will work. It's also important to concentrate that the aim is to improve the quality of care, not to reduce costs. Often people get suspicious that actually what you're really trying to do is take away their resources, get them to do what they're doing in a cheaper way. It may be that improving quality, there will be cost savings, but that should be kept not as the open objective. The open objective should be improving quality. And then finally, whatever method is taken on board, be it education, be it regulation, be it incentives, almost certainly what you need to do is to use a combination of methods and then also change them every so often, because the initial impact will wear off and you will need to switch to some other approach. And I think if you follow those 4 rules, then generally speaking you will be successful in improving quality of care.